Chapter 11. The function of the cardiovascular system is to deliver oxygen and nutrients and to remove carbon dioxide and other waste products. Describe the pericardium, including the layers that make up its pericardium. The pericardium is a double-walled sac, SAC. That's fibrous. Pericardium is loose and superficial. Serous, S-E-R-O-U-S, membrane is deep to the fibrous pericardium and composed of two layers, the visceral pericardium and the parietal pericardium. The visceral is next to the heart, also known as the epicardium. The parietal is the outside layer that lines the inner surface of the fibrous pericardium. Serous fluid fills the space between layers of pericardium. Identify the three layers of the heart wall. The epicardium is the outside layer. This layer is visceral pericardium. It's the connective tissue layer. The next layer is the myocardium, which is the middle layer, mostly cardiac muscle. It's endocardium. And then the third one is endocardium, the inner layer, and endothelium. Again, the three layers are epicardium, myocardium, and endocardium. Describe the following parts of the heart. The atria or atrium are the receiving chambers, the right atrium and left atrium. Ventricles, they are the discharging chambers. They have a left ventricle and a right ventricle. The interventricular septum separates the two ventricles. The intertrial septum separates the two atria, or atria, A-T-R-I-A. The bicuspid valve is the left side of the heart, and the tricuspid valve is the right side of the heart. The pulmonary semilunar valve is between the ventricle and artery. The same with aortic semilunar valve. The pulmonary semilunar valve and the aortic semilunar valve are both between ventricle and artery. The order of blood flow. The proper order of blood flow through the heart and body. Right atrium, tricuspid valve, right ventricle, pulmonary semilunar valve, pulmonary trunk, R and L, right and left, pulmonary arteries, lungs, right and left, pulmonar veins, left atrium, bicuspid valve, left ventricle, aortic semilunar valve, aorta, body systems, superior and inferior vena cava. The job of the coronary arteries, they branch from the aorta to supply the heart muscle with oxygenated blood. Cardiac veins, they drain the myocardium of blood. Coronary sinuses are a large vein on the posterior of the heart. They receive blood from cardiac veins. The 5 parts of the heart's conduction system. The 5 parts of the conduction system are the sinoatrial node, atrioventricular node, atrioventricular bundle branches, and Purkinje fibers. Purkinje is Purkinje. Define the following. The tachycardia is the rapid heart rate over 100 beats per minute. Bradycardia is a slow heart rate less than 30 beats per minute. The systole is contraction. The diastole is relaxation. Cardiac output is the amount of blood pumped by each side ventricle of the heart in 1 minute. Stroke volume is the volume of blood pumped by each ventricle in 1 contraction. The artery the arteries and arteriole carry blood away from the heart, while the veins and venules return blood toward the heart. One complete cardiac cycle of the heart is the atria contract simultaneously, the atria relax, then ventricles contract. The systole is contraction, and then the diastole is relaxation. List the 4 things that will increase the heart rate. Four things that will increase the heart rate is sympathetic nervous system, hormones, exercise, and decreased blood volume. 3 things that will decrease the heart rate is the parasympathetic nervous system, high blood pressure or blood volume, and decreased venous return, VENOUS. The main difference between arteries and veins. Veins return blood to the heart, and arteries carry blood away. Describing the special circulations, including the circle of Willis, fetal circulation, and hepatic portal circulation. The circle of Willis, anterior and posterior blood supplies to the brain are united by small communicating arterial branches. This result is the complete circle of connecting blood vessels called cerebral arterial circle or circle of Willis. Fetal circulation. Fetus receives exchanges of gases, nutrients, and wastes through the placenta. The umbilical cord contains 3 vessels, the umbilical vein, and 2 umbilical arteries. The hepatic portal circulation. Hepatic portal veins carries, so the veins of hepatic portal circulation drain digestive organs, spleen, and pancreas. The hepatic portal vein carries this blood to the liver, and the liver helps maintain proper glucose, fat, and protein concentrations in the blood. The 2 numbers of blood pressure are systolic and diastolic. Systolic is when the blood is pumping, and diastolic is when it's at rest between the beats. To be considered a normal blood pressure, blood pressure is a 120/80. It's 140 to 110 Hg systolic and 80 to 75 mmHg diastolic. What is considered hypotension and hypertension? Hypotension is often associated with illness. Low systolic is below 110 mmHg. Hypertension can be dangerous if it is chronic. It's high systolic above 140 mmHg.